I'm Luann Fortune with the College of Integrative Medicine and Health Sciences, and I'm here at Saybrook University for our Dean Seminar. And it's my honor to introduce Sylvie Maury, Ph.D., ACC, who is an executive resilience and wellness coach with a global background in leadership and a strong focus on well-being grounded in research. She earned her PhD in mind-body medicine from Saybrook University, where I was actually her chair, where she explored the resilience of single working mothers during the COVID-19 pandemic. Her findings inform the creation of the Resilience and Wellness Wheel, a practical coaching tool that supports awareness and adaptation in high-stress environments. So Sylvie integrates neuroscience, mindfulness, systems thinking to help leaders, teams, and individuals navigate complexity, make clear decisions, and grow through challenge. She is fluent in several languages, which has always amazed me. She brings an international lens to her work, emphasizing connection, balance, and forward movement. And she's based in Nashville, Tennessee, where she's active in professional coaching communities, including the International Coaching Federation. She works with leaders to empower them to create psychologically safe environments, build trust, and drive lasting transformation, especially in high stakes, high change contexts. So Sylvie, welcome. And I'll hand
Thank you. Well, thank you so much for giving me this opportunity first to present my thesis tonight again. And it's really nice, I think, to have a break and made me look, like I mentioned to you before, at the research and see what changed since I found what I found. And it was interesting that I'll talk about the changes later, but it was very interesting. Resilience during the COVID-19 pandemic, experiences of single working mothers, which was published in 2023. And I want to thank you, Luann, and also Dr. van der Linden and Dr. Dickey for being part of it. I was lucky to have such a great team with me. So it really helped. So thank you. So today, I'm going to describe, you're going to find out, about my research topic and understand why I chose it. You'll hear about the problem, the research question, the significance of this research, and very importantly, I'll talk about the methodology and the analytic method, which I fell in love with. So I think it's important. I'll also talk about the findings and its implications. Next slide, please. So the problem. The number of single mother families is on the rise worldwide. And this is where I not changed, but yes, a little bit, the numbers. So the number of single mothers families is on the rise worldwide. And the number, the US Census Bureau's in 2023, single mother families represented 25% of US families and 13% of families worldwide. In my research, I had found that in 2020, this number was 20% of US families. So it's increasing really fast. Also, again, another number that I think that is very important, again, from the US Census Bureau in 2022, 23% of single mothers live in poverty compared to 5% of married ones. Another statistics is that in 2024, single mothers in the US represented 80% of the 13.7 million single parent families with children under 18. So that number in 2022 was 11 million. So you can see really an increase in single parent families and mostly with mothers. Also on March 11, 2020, the World Health Organization declared the COVID-19 outbreak a pandemic. And after that, we had strict lockdowns and social distancing measures worldwide, which really exacerbated the challenges in single working mothers' lives, because they also had to handle their finances, the care of their children, and their homes. And because of these increased challenges, really wanted to hear their voices and understand their experiences of resilience during the pandemic. So, following a feminist lens and choosing to conduct a qualitative research, I asked, how have single working mothers experienced resilience during the COVID-19 pandemic? So I think that this research also understanding single working mothers' resilience during a crisis such as the pandemic can help nonprofit organizations and government agencies provide the necessary resources to help this vulnerable population increase its resilience. Also, this study adds to the literature on single mothers, on resilience, and on the COVID-19 pandemic. So, briefly, yes, the literature. So, there was a big gap. The very few studies investigated the experiences of the resilience of mothers during the pandemic, and fewer of the resilience of single working mothers during this crisis. And this gap in the literature is concerning, as according to the US Census Bureau, the percentage, like I discussed before, of single mother families in the US family makeup has been slowly and constantly increasing from 10% in 1965 to now 25% in 2023. And seeing this gap in the literature, I concentrated my research on first looking at the literature on working mothers, and then single mothers, mental health, and resilience, and all within the context of the COVID-19 pandemic. So the pandemic put forward working mothers 4 shifts. This is one thing that I really found. At first, there was their work, then the care economy, which is non-paid, the emotional labor, and distance learning. So these accrued responsibilities often led to exhaustion, and which is the first sign of parental burnout. Doing this research, I learned a new term, which is parenting role overload. And this happens when the roles overwhelmed by using too much time and too much energy. And a study by Kogers et al. In 2021 found that women suffered more than men from parenting role overload during the pandemic. And this concerned mainly mothers taking care of their children's schoolwork. So the COVID-19 pandemic also reopened the debate on gender gap in parenting roles and unemployment. And I did a lot of research on that. And then about resilience. So what came out for me is really that in the literature, the resilience from mothers during the pandemic emerged in the little things. So sometimes it was just being self-aware, creating new routines, finding creative ways to maintain some kind of normalcy, accepting what was happening, persevering, and finding positives in their experiences, which was a big one too, and also practicing mindfulness. Next slide, please. So the methodology. I chose to conduct a qualitative research with narrative inquiry. And the narrative inquiry methodology helped me to listen to and understand my participants' stories of resilience during the COVID-19 pandemic. And Clandon in 2016 explained that narrative inquiries are relational inquiries, subjectively part of the inquiry. And I intentionally chose to study single working mothers' experiences because of my own experience as a single working mother. It made me wonder about others' experiences during the pandemic. For my analytic method, I decided to use the listening guide method, which is an analytic method of listening to participant psyches using psychoanalytic and feminist perspectives, which enabled me to go beyond my participants' words and listen to their unconscious to unveil their complex voices. So I recruited on Facebook and LinkedIn 9 single working mothers who self-identified as resilient. For the inclusion criteria, it was all based out of when the pandemic started, so March 11, 2020. And all the women had to be non-pregnant at that time, aged between 18 and 65. They had to be fluent in the English language, having at least one child under 18, living in a solo home, working full-time. And if they were divorced, they had to have 50% or more custody of their children. So the data collection, I conducted an hour in-depth open-ended interviews on the Zoom. And I started our meetings, by asking demographic questions timed again as of March 11, 2020. And I asked about their ages, the age of their children, their work, ethnicity, race, custody situation, if any. I also asked if anything had changed since. Next, I invited also each participant to take 3 mindful breaths with me. I wanted to increase presence and also foster relaxation before we really started our interview. And then I started our interview and the first question I asked was, how did you experience resilience during the COVID-19 pandemic? So I also wrote field notes, very few during the interview, but I did some right after and days later too. And these notes created questions, and I recontacted some of my participants for clarifications. Next slide, please. So the listening guide. The listening guide is a method that I fell in love with. So it has a specific listening process, which consists of 3 distinct listening, each one taking researchers deeper into the participants' inner world. So the first one is listening for the plot. It is retelling the story and situating the narrative within its multiple contexts. It involves asking what, when, where, why, and with whom questions. So I started by asking myself, after I listened to the recording and read the transcript, what made this interview surprising? And then I observe emotions, contradictions, gaps, the unexpected, noting metaphors, and I position also myself within the research. And on the scripts, I use different colors to highlight words, repetitions, topics, verbal behaviors, emotions, and silences. I also included my participants' demographic information answers because it was really part of their context. I also wrote my reactions, assumptions, and questions. So the second listening is listening for the I, and it has an associative logic that helps the researcher enter participants' inner world. It is to understand how the participant speaks about herself. For that, I listed all the I plus verb from each transcript. And then I noticed, do they use I when they speak about themselves, or we, or you, or they? And the third listening is listening for contrapuntal voices. It is listening to what is said and not said within the participants' multi-layered voices, in contradiction or not. This step is a long process of listening to a possible voice, describing it, explaining its relevance, keeping it, or looking for another one. For that, I listen to the tone, rhythm, pace, and musicality of each voice. Um, and I finally found similarities between participants' voices and combined them when possible. Next slide, please. You can click another time. Yeah, thank you. So the findings from the demographics, again, from March 11th, 2020. So the single working mothers were between 34 and 53 years old. They were living with one or two children in their solo home. And the children were between 5 months to 21 years old with a median age of 11 and a half. They identified themselves, so 5 of them as white, one as a Latina, one as a Latina white, one as a Black, and one as an Arab American. For their work, there was one teacher, one behavioral intervention specialist, a therapist, a hairdresser, a lawyer, an internal communication manager, senior sales director, chief of staff, and a director of learning services. 78% had graduate degrees. 7 lived in the US, 2 in Switzerland. 4 shared custody with their exes. 1 had limited supervised visits. 4 had no contacts with their children's fathers. So, observation on mindful breathing. 7 out of 9 participants gave their feedback on their experiences. So, as a reminder, I offer to take 3 guided, slow, and deep breaths at the beginning of the interviews. So, 5 out of 7 found the experience positive as it helped them focus and relax, but 2 did not. They were surprised. For me, it helped me focus and be a better listener. So, the definitions of resilience by participants. They define resilience from their experiences. One preferred to use the word mental fortitude to resilience, thinking that resilience was overused. Others compared resilience to a muscle, spectrum, survival, strength, faith in the future, growth. And their definitions morphed into a synthesized definition, which is resilience during the COVID-19 pandemic, was a process that led to learning and growth and included acceptance of what is and change, and telling agency, perseverance, positivity, self-awareness, self-compassion, and self-care. Next slide, please. So the findings from the listening guide. Um, as a narrative inquirer, so I really intended to give voice to the experiences of resilience of single working mothers during the COVID-19 pandemic. And this method, the listening guide method, gave me the tools to hear their non-intentional voices. I heard the voices they wanted me to hear and the implicit ones as well. The I poems, also called voice poems, and the contrapuntal voices freed my participants' unconscious voices. So the voice of the I poems, here you're going to listen to examples of the I poems from Naomi, Jess, and Elena, not their real names, the participants of the study though. So Naomi, I will say, I can't tell, I can't just tell. I believed, I couldn't see. I believed, I knew, I was gonna get out. I didn't know, I didn't see. You can make it. You are going to learn and grow. Jess, I've created. I'm doing. I'm going to do. I'm going to do. I'm not going to quit. I'm not going to give up. Elena, I didn't want to worry. 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 I needed to just be. So the contrapuntal voices that I found I found 6 of them. The voice of diffidence and guilt versus voice of confidence. The voice of compassion and gratefulness versus voice of frustration. The voice of not being enough versus voice of being enough. The voice of reinvention versus voice of sameness. The voice of suffering versus the voice of healing. And the fighter voice versus the surrender voice. Next slide, please. So the new definition of resilience includes a combination of the characteristics observed in all single working mothers. And those are self-awareness, perseverance, acceptance, self-compassion, positivity, agency, and self-care. So self-awareness, give you the example of Emma that did her inner work and explained that resilience came, as she said, as a consequence of all the work that I had done on myself. Acceptance. Single working mothers acknowledged that resilience meant accepting what was. And Sophia explained, we took it as it came and tried to make the most of it. For self-compassion, Lisa said, you can't be the perfect mom. For positivity, Naomi explained, I knew that this wasn't my forever. Agency, Jess fought her custody battle, changed her state law to include coercive abuse in the abuse definitions in her state, and created her support system. Self-care. Self-care became a need fulfilled according to everyone's preference and resources. Marta listened to The Power of Now by Eckhart Tolle. She put it constantly, 24 hours. She just listened to it. And she explained, just finding the joy of being present, when you're present, you don't worry about the future or the past. Perseverance. Jess persevered in creating a support system, finding child care, fighting her custody battle case, and changing her state law. She explained, resilience was sticking with my commitment to keep my daughter, fighting for her and other families. Next slide, please. Voice is heard. So I'll give you the analysis for Naomi. You've heard her I poem before, and this is for her I poem. Naomi lived in a challenging psychological state, worrying about her homelessness, hunger, and a mental state while pretending to be on a staycation in a hotel for her children. Her I poem revealed her pretending or lack of confidence in her contradictions when she said, I knew, I didn't know, I can't tell, I can't just tell, I was gonna get out. Her poem showed her doubts and a lack of confidence I hadn't noticed during our interview. It revealed what was not said out loud. At the same time, I saw there her conviction that she will survive her difficult situation and would find proper housing for her family. Naomi grew during the COVID-19 pandemic and transformed, understanding that she had to fight her state laws to protect those like her who live just above her state's poverty salary limit. So for contrapuntal voices, I'll give you the example of Nicole, Lisa, and Sophia's voices of not being enough versus voices of being enough. It revealed a systemic struggle connected to the stereotyping of single mothers found in the literature, showing single mothers as less than. Nicole, the owner of a law firm, had to prove that she was a good enough entrepreneur. Lisa always thought she was not a good enough mother until her daughters told her how much they admired her. Sophia noticed that she never had enough time for her children, her work, her partner. She felt pulled from all directions. However, the work flexibility of the pandemic changed her perceptions of not having enough time. Next slide, please. So the implications. The listening guide as a whole system in which each listening is interdependent on the other two and contributes to the whole analysis. Listening for the plot revealed how participants wanted to appear in their stories and how I was affected by their telling. Listening for the I, the second one, revealed the dissonances and confirmations of attitudes that added to my understanding of their experiences. And the last one, listening for contrapuntal voices, is where I combine similar voices in different contexts, which helped me zoom in and out of the stories to see the larger picture supporting a feminist lens by outlining the gaps in system support. I could see how our society failed to support single working mothers during the pandemic. So, mindful breathing considerations. I recommend informing participants before the interviews and allowing them to accept or refuse to participate. And this way, I would eliminate the surprise effect. I would also recommend inviting participants' feedback at the end of each interview instead of weeks later. Contribution to practice. So the new definition of resilience can be translated and applicable in professional coaching services. The resilience and wellness wheel that you see here can be used as a coaching tool to help coaches and their coachees understand where they stand on their resilience and wellness. And the 7 domains of the wheel are the characteristics in the new definition. And clients can choose either to quantify or color their perceptions of where they stand on each domain. And this created awareness would help them. I mean, I've used it, decide which domain to work on with their coach. Next slide, please. So the limitations first of this research. I studied single working mothers, which limits its reach and understanding of single mothers. Also, I recruited 7 participants from the US and 2 from Europe. And knowing that different countries apply different COVID-19 restriction, and this recruitment limited the understanding of a population within a country. Also, the self-reporting nature of the qualitative interviews might have led to inaccurate reporting. Also, the single working mothers identified as resilient, which could have influenced the positivity of their telling and limited the complexity of the concept also. Also, the timing of this research. I mean, the study recruited participants 3 years exactly after the beginning of the lockdown and the pandemic. And this could have affected the memory of the participants. So for research, for the future research, I recommend using the listening guide method when studying any vulnerable population and when filling the gap on single parent research. I also see the need to study the relationships between the 7 characteristics of the definition and learning and growth. I would love to also to see a study the difference of grounding techniques that could be used at the beginning or during interviews to foster relaxation and focus. And also study the resilience and wellness wheel as a resilience model in coaching intervention, and study the importance of each characteristic in single working mothers' lives. Next slide, please. So now you've seen how using the methods that I chose and hearing the voices using the listening guide really gave me the tools to answer my research question. And the findings in the study, though, do not negate our societal responsibility to provide better systems for these women. We really have fallen short in not supporting the single working mothers in our societies during the pandemic. And we still need to take responsibility and act to make those improvements. As the 2 of the participants in this study, they were, yes, Naomi and Jess, they stepped up to work for social change despite their challenges. So personally, I had promised my participants to make their voices heard. And since then, I've been on podcasts. I wrote many posts on social media. And actually, in 2 weeks, I have an article that I'm interviewed for an article on that. So thank you.